Hello, my name is Dickon Hayne, and I'm going to be presenting in the trials in progress section zirconium labeled girentuximab PET in urothelial cancer patients, or the ZiPUp trial, which is a phase 1 trial of a novel staging modality in urothelial carcinoma. There are my conflicts of interest and disclosures. So urothelial cancer is a lethal disease with a rising incidence and poor outcomes. Of course, best treatment is impossible without meaningful staging. And staging modalities at the moment are basically contrasted CT, chest, abdo-pelvis, or in some centers, an FDG PET-CT. CT has a low sensitivity for detecting oligometastatic disease, and FDG PET is somewhat limited by the fact that it's renally excreted tracer. This causes intense urinary tract activity, and it's hard to look at the bladder, look for upper tract lesions, or even nodal metastases that are in close proximity to the urinary tract. So zirconium girentuximab PET has not previously been investigated in urothelial cancer. Girentuximab is an antibody and a carbonic anhydrase 9 ligand. Zirconium TLX250 is the agent that we're using is metabolized hepatically, so there's actually minimal renal excretion. It's already been shown to have utility in the staging of renal cell cancer in the ZIRCON trial, and it may equally have utility in staging of urothelial cancer, and certainly carbonic anhydrase 9, which is a marker for hypoxia, is seen on numerous urothelial tumors. There's also the potential theranostic option because the zirconium can be swapped out for therapeutic lutetium to treat areas of uptake. So ZiPUp is a single-arm phase 1 trial looking at feasibility, safety, and utility of zirconium TLX250 PET-CT in patients who are either undergoing a preoperative staging PET or are known to have metastatic urothelial cancer. So all patients will have had a zirconium PET and also an FDG PET for means of comparison. And we're trying to recruit 10 participants for staging and 10 participants who are known to have metastatic disease, making 20 in total. And really, the primary endpoint is a comparison of the sensitivity and specificity of the ZiPUp PET compared with a standard FDG PET. Secondary endpoints such as safety, tolerability, and feasibility will also be examined. The study schema is shown there. So far, we've screened 33 patients, 21 have consented to therapy. Unfortunately, we've only been able to scan 8 patients so far. We had lots of issues during the COVID-19 pandemic with access to the investigational medical product, which had to be transferred from Canada to Australia, which was fraught with difficulties during COVID. However, we're now strongly recruiting again, and we hope the study will be completed by the end of the year. Of course, if the ZiPUp PET-CT is proven to be feasible, safe, and effective in staging, then it could improve selection of patients for treatment, either with primary or with metastatic urothelial cancer or bladder cancer. The figure just shows an example of a single patient at the same slice with a contrasted CT at the bottom. Then there's the FDG PET, where you can see the bladder is all super hot because of the urinary excretion. And then at the top, the ZiPUp PET just showing uptake in tumor and no uptake in the bladder. That's the end of the presentation. Thank you.